So, as we just heard, the government remains under pressure over the supply of personal protective equipment for health and care workers in England. An RAF plane carrying protective gear from Turkey arrived here overnight, but ministers say there's a global shortage. More than 8,000 businesses have responded to an appeal to manufacture products locally. But the government says not all those offers can be taken up. Here's our health editor, Hugh Pym.
Personal protective equipment for health and care workers is in great demand around the world, with a massive increase in what health systems require because of the pandemic, and the NHS is no different. There's been a rush to secure supplies, and there have been reports of shortages. Some GP practices say they aren't getting adequate supplies through official channels.
We did run out of these completely in the last couple of days, so I had to go out and buy some of those.
GPs here feel especially vulnerable because they run a coronavirus assessment centre.
It's just quite terrifying because it's not just a risk to yourself, it's a risk to everyone around you. And I mean, we all know the bad effects that COVID can carry, so it's just scary. It's almost like you feel like you didn't, really sign up for this.
Some hospitals have adequate quantities of PPE, but others say they're down to only a few days' worth of supplies. And staff say the uncertainty can be unnerving.
Another added stress is the lack of sort of honesty and transparency. And I think it is very difficult to be going to work and being asked to see a patient without adequate PPE, and then to be hearing, that there is adequate PPE. I don't think that's the situation we want to be in.
One trust in Lincolnshire revealed just how much PPE they get through. At 3 main hospitals, they use almost 73,000 items each day, things like surgical masks, gloves and gowns. Based on the trust's size and the number of coronavirus patients it's dealing with, BBC analysis suggests the total daily usage at English hospitals would be in a range of 10 to 16 million items per day. The government says around 14 million units have been distributed daily in recent weeks in England.
NHS supply chain.
Since the virus threat became clear, the UK authorities have struggled to find enough supplies overseas, and experts say there's a lesson there.
We've relied on being able to buy all these things from low-cost countries, low-cost sourcing countries like China, on the assumption that they would always be available. So we've lost our domestic industry in many areas that are really important for government, for different parts of the government.
Companies like this one in Yorkshire are keen to help. It started making more than 10,000 face shields each day. It's supplied some local hospitals, but has had no firm commitment yet from the government.
We'd really like to help the NHS first. Obviously, it's our country, isn't it? We need to all help. But with the amount of money that the company's spent so far, it might have to come that we will supply to the US.
Ministers say thousands of offers from companies are being assessed, and ensuring that the right equipment is provided is the priority.